Hi, I'm Dr. Craig Duval of Sherwood Dental. In these early days of COVID-19 uncertainty, I'm recording this as I want to reassure our patients. Sherwood Dental will remain open and we will continue to serve our patients in a calm, sensible and safe way. At all times, we will be guided by advice from Queensland Health, the Australian Dental Association and the Dental Board of Australia. Dentistry in Australia is well placed in the situation that is unfolding. We use masks, gloves and protective eyewear for every patient. We wipe over all of our surfaces and dental chairs after every patient and either wash our hands or use hand sanitizer before and after treatment. Even with that, we're going to be stepping up some of what we do to enable us to continue to serve our patients and increase safety. The team is now going to both wash their hands and use hand sanitizer when arriving at work for the day, before and after every patient, before and after eating, before and after toilet breaks, prior to leaving, and at any other time that they see it's appropriate. We're also going to be adding face shields to our personal protective equipment. Now, some may say that this is too early for such precautions. But in dentistry, I've always believed that prevention is far better than cure. Essentially, we will continue to be able to serve you for as long as it is safe to do so. Although we're in the very early stages of COVID-19 spread in Australia, we're going to learn from the overseas experience and implement measures now for our patients to ensure we protect the most vulnerable patients in society. Current data suggests that for many, perhaps even 80%, COVID-19 will only be mild. But our aim is to protect our team, protect our patients, and in doing so, ensure we protect the most vulnerable members of our society, the elderly, those with chronic conditions like diabetes, those undergoing chemotherapy treatment, and the list goes on. We're also going to ask our patients to observe the increased social distancing philosophies as suggested by Australia's Chief Medical Officer, Professor Brendan Murphy, and the Australian Health Protection Principal Committee. This afternoon, our Prime Minister has asked that anyone returning from overseas goes into self-isolation for 14 days. We're going to go a little bit further and ask that anyone who has travelled and returned from overseas since the 2nd of March, can you please reschedule your appointment until you've been back in Australia and symptom-free for 14 days. We know that the highest risk profile group in Australia are those who have returned from overseas in the previous 14 days. So we ask you please to understand our additional precautions. We will also be conducting a mandatory questionnaire for every patient. Although this may not be necessary for several weeks, we're going to implement it from tomorrow, Monday the 16th of March. As an additional early precaution, our front doors will now be locked, even when we are open. When you approach the doors, please be patient and our team will press the button to let you in. This is so, once you enter, our team can show you the way to our hand wash stations where we will ask every patient, every time, to wash their hands for 30 seconds using a disinfectant soap and water. We have disposable paper towels for you to thoroughly dry your hands afterwards. Our team can also dispense an alcohol hand sanitizer and we'd invite you to use that as well if you wish. At each hand wash station, we've put up the Australian Dental Association guidelines that were implemented with the World Health Organization back in 2009. So you can be confident that we've been following best practice for a long time and will continue to do so. Although we would love to greet you with a handshake and a hug as we've often done in the past, our team will now be greeting you with their best smile so that we observe the new precautions. For your peace of mind, if you have any symptoms and wish to cancel or reschedule your appointment, we will be waiving all rescheduling and cancellation fees and timeframes. Even if you cancel just prior to arriving, we will understand and wish you a speedy recovery if it's for illness. Also, you may be asked to do additional work while you can. We understand. For the majority of our patients who are healthy and well, you may want to consider bringing your appointment forward while we are open. On the ABC Insiders program this morning, Professor Murphy did not rule out lockdowns and closures that we're currently seeing in Europe. Asked specifically if it was possible that a city the size of Sydney could be locked down, he replied, potentially it could. So we've allowed significantly more appointments. I'll be working increased hours over the coming weeks while it is appropriate to do so, including the weekends if there are sufficient patients who want to complete their necessary treatment. If you have an upcoming appointment in the next few months and would like to bring it forward, I'd encourage you that while we're still in such early numbers of COVID-19 cases in Australia, that may be a wise choice. We will be adding as many patients to our priority list so that our team can bring you forward and offer you an appointment sooner if that's what you request. If there's anything niggling right now especially, then I'd encourage you to consider bringing your appointment forward. At the moment, we want to do our best to look after you and serve our patients, because if we do have to close, we don't have any idea on the duration that we may have to close for or the conditions under which we'll be able to reopen. So our front office team of Megan and Letitia will be offering earlier appointments over the coming days and personally inviting patients to schedule during some of our additional opening hours. We thank you for your support as we seek to continue to serve you while keeping you, your family, and the most vulnerable in our community safe.